my PICO project, I'm looking at if functional knee braces help improve strength in post-ACL reconstruction patients. First, we will look at if they actually help improve strength. We'll look at benefits of functional knee braces, disadvantages of functional knee braces, and if there are any other options besides using functional knee braces. First off, we will explain why patient strength is altered after reconstruction surgery. One is because of the increased torque at the ankle and hip. It is actually increased 11.6% during walking and 17.7% during running. This is due to alterations during gait, such as in trying to inhibit anterior translation of the tibia and just learning the proper gait after surgery. Also, this decreases strength in the quadriceps and increases the strength in the hamstrings and gastroc. This is also to help teach the patient how to control the tibia's anterior translation. So now, next we will look at the benefits of functional knee braces. One, they protect the recent reconstruction. As the reconstruction is still healing, you want to make sure that there is not too much anterior translation or overstress at the knee. Also, gait adaptations prevent this anterior translation. There's also a decreased angular impulse at the knee, which just means there's less stress. This stress, since it is reduced at the knee, is then moved to the ankle and hip to help even out the kinetic chain. Also, this causes alterations in your torque patterns, causing the hip and ankle to receive more torque and take away from the knee to help protect it. Also, it improves spinal reflex times as there is proprioception on the knee to help it know how to react to certain incoming forces. Also, it helps develop neuromuscular adaptations during things like gait and your rehabilitation training that help decrease the load placed on the knee. Next are the disadvantages of the functional knee brace. One is that there is less force in the quadriceps and an increased force in the hamstrings. This increased force in the hamstrings could lead to possible hamstring injuries. Also, it causes the knee to be in an extended position, considering that the anterior cruciate ligament helps the tibia from going into anterior translation, and this is caused by hyperextension. This position of hyperextension could be potentially harmful and cause the injury. Also, there's a decrease in knee movement and power. This could also cause injury in other areas of the body and could decrease performance of the athlete. However, the biggest disadvantage of functional knee braces is their controversy of whether or not they actually work during high level of sport activities. This can be potentially problematic as most collegiate athletes participate at high levels of activity. The knee brace does not actually work at high level activities. Why are we even putting our athletes in them? So what other options are there besides a functional knee brace for our athletes? Well, one is a neoprene sleeve. This is just a simple sleeve that goes over the knee and provides just something there. It usually helps with them mentally, just to give them a sense of stability and protection, although it really doesn't do a whole lot. Or the athlete could choose to do no brace at all. This would help with just working on their strength and their control and their range of motion and making sure that they are physically able to return to play and not be required to have a brace or be relying on the brace for protection. So in conclusion, strength can be both increased and decreased due to the functional knee brace. Hip and ankle musculature is increased as torque and power are then drawn to the hip and ankle and away from the knee to help protect it. Also, the knee musculature is decreased to help with the control of the anterior translation and the protection of the recent reconstruction. Also, there's a question of the validity and high levels of activity. Personally, I think it is our job as athletic trainers to look into this situation further and really decide if it's the best thing for our athletes or if if there's other possibilities that have yet been discovered to put our